Trying to manage your heart health, it can feel pretty overwhelming, right? But what if you had a clear roadmap to follow? Well, today, that's exactly what we're looking at. We're breaking down a program that turns a really complex journey into simple, manageable steps. So let's get into it.
Think about that for a second. It's a pretty big question, isn't it? We usually think of serious health stuff happening in a hospital or a specialist's office. But what if those first, super important steps could happen somewhere you go all the time?
So here's the thing about high cholesterol. It's sneaky. It usually doesn't have any symptoms, but it's one of the biggest players when it comes to heart disease. This program is all about dragging that silent risk out into the light and giving people a real community-based plan to tackle it.
Okay, so why? Why does a program like this even need to exist in the first place? Let's get to the heart of the matter.
Just let that sink in for a moment. A third of all coronary heart disease is linked back to high cholesterol. This isn't some minor issue on the sidelines, it's a massive public health challenge. And that right there is the core reason this program was created. And here it is. This is the official roadmap we're going to be following today. It's the exact flowchart pharmacists use with their patients. Now, I know at first glance it might look a little complex, but don't worry, we're going to walk through it together, piece by piece, so it becomes a simple, easy to understand map for your health journey.
All right, first things first. Who is this roadmap actually for? Let's take a look at who's eligible to see who can get started on this path.
The big takeaway here is how accessible this is. It's designed for a really wide range of adults who've been told they have what's called dyslipidemia, which is basically just the medical term for unhealthy cholesterol levels, and they're ready to do something about it. It's for people who aren't already under a specialist's care for more complex heart conditions.
And this is actually a really smart part of the program. It's not about turning people away, it's a safety net. The program knows its limits. So if you have a more complex situation like type 1 diabetes, or you've had a recent heart attack, it makes sure you get referred to the specialist care that you need. It's all about getting you the right care from the right person. Okay, so let's say you're eligible. What happens next? Let's look at that very first visit. It's all about getting a really clear picture of where your health is at right now. It's not as intimidating as it might sound. The whole thing really boils down to 3 straightforward steps. First, you just have a conversation about your history and lifestyle. Then, the pharmacist takes a few key measurements, like your blood pressure. And finally, you go over your cholesterol test results together. Simple, structured, and it gives everyone a complete picture to start from. And here we are, right back at our roadmap. You can see this whole patient history and assessment piece is right at the top, just after checking if you're eligible. This is the foundation. Everything else in your plan gets built on this first step. So, with that health snapshot in hand, it's time to build your personal action plan. And the program uses a really powerful 2-part approach to do this. This action plan is all about balance. On one side, you've got lifestyle habits, the things you can control, like diet and exercise. On the other side, you've got medication. If it's needed, pharmacists can prescribe proven treatments, and the first choice is usually statins, which are great at helping lower the bad cholesterol your body makes. It's a strategy that combines your own efforts with solid medical support. And again, if we look at our roadmap, you can see these 2 strategies sitting right next to each other: non-pharmacological measures and pharmacotherapy. They're the guts of the whole develop and implement a management plan section. It really shows that it's not an either-or situation. It's about finding the perfect combination that works for you. Now, making a plan is a fantastic start, but let's be honest, the real magic happens in the follow-up. This isn't a one-and-done visit. It's an ongoing partnership to make sure you're actually succeeding. So, how do you know if the plan is working? Well, you track your LDL-C. That's the one people often call bad cholesterol because it can build up in your arteries. As you can see here, the program gives you a clear, specific number to aim for based on your personal risk level. This isn't guesswork. It makes success something you can actually measure. The support is structured too. At 6 weeks, there's a check-in to see how you're doing. If you're still not hitting your targets after 6 months, the plan has a built-in referral to make sure nothing gets missed. And after that, there are regular reviews to keep everything on the right track for the long haul. And this brings us to the final stretch of our roadmap, which is all about that long-term commitment. You see the words right there: monitoring, collaborative care, and ongoing management. The most important thing to take away from this is that you are not alone on this journey. The whole system is designed to support you, adapt with you, and work together with your other doctors. Look, the path to better heart health can seem like a really long and confusing road, but as we've just seen, having a clear map can make all the difference. This program gives you that map, and it starts somewhere as simple as your local pharmacy.
So the only question left is, are you ready to take that first step?